Hey everyone, did you know that Medicare Plan N may leave you with unexpected medical bills? Many people choose Plan N because of its lower premiums, but there's something important you need to know, and that's excess charges. Stick around because I'm going to explain exactly what excess charges are and how they can impact your costs, and most importantly, how to avoid paying them altogether. Before we dive in, make sure you check out my free Medicare 101 guide, which you can download using the link below in the description. Be sure to check that out. Now, before we dive into the excess charges, let's do a quick overview on what Medicare Supplement Plans, or also known as Medigap plans, how they work. So Medigap plans work alongside original Medicare and help pay the out-of-pocket costs that Medicare doesn't cover, such as deductibles, coinsurance, and copays. Plan N is one of the most popular Medigap plans because it has lower premiums than Plan G. However, there is a trade-off. On Plan N, you're going to have some out-of-pockets like a copay of $0 to $20 at each office visit and $50 at the emergency room. Now, if you're admitted into the hospital from being in the emergency room, they will waive that $50. Also, Plan N does not cover Part B excess charges. So what are excess charges? So when you go to a doctor with Medicare, Medicare is going to set an approved amount for the service that you receive. Some doctors, however, can legally overcharge up to 15% more than what Medicare approves, and this is called an excess charge. The Medigap Plan N does not cover excess charges, so that means you're going to have to pay the difference out of pocket. These excess charges only apply to Medicare Part B services, which include doctor visits, outpatient care, diagnostic tests, and other items covered under Medicare Part B. So the good news is that not all doctors charge excess fees. Doctors who accept Medicare assignment agree to Medicare's billing terms and cannot charge excess fees. However, doctors who do not accept assignment can bill up to 15% extra on top of the Medicare Part B charge. To find out if your doctor can overcharge you on the excess charges, you can simply visit Medicare's website, medicare.gov, and type in your doctor's name, and you can see if they accept Medicare assignment. If they accept Medicare assignment, they cannot overcharge on the Part B, and you cannot have an excess charge. Also, you can ask your doctor if they take Medicare assignment. The answer is yes, then you will not see a Part B excess charge. So like I said, the easiest way to avoid an excess charge if you have Plan N is to simply check ahead of time if your doctor takes Medicare assignment. Another way to avoid excess charges is if you live in a state that does not allow them at all. These states would be Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. In these states, excess charges are not allowed, so if you have a Plan N, you don't have to worry about Part B excess charges at all. If you have a Medicare Supplement Plan N and you don't live in one of the states I just mentioned, and you're concerned about the excess charges, you can consider a Medicare Supplement Plan G instead. Plan G covers the excess charges at 100%, so you will not have to worry about them at all. I can say that in our experience doing Medicare over the last 10 years and helping thousands of clients, we've never seen a client encounter an excess charge on a Plan N. At least they've never told us about it. So I do think they are pretty rare. That being said, we do have to let our clients know that that is a potential exposure on the Plan N. So if it does happen, they're not surprised by it. They know it is possible. But they also know how to avoid it, and that's simply by checking to see if your doctor takes Medicare assignment, which, like I said, you can do right on medicare.gov. If you're unsure whether Plan N is the right fit for you, or you have questions on your Medicare, be sure to give us a call at the number below. We'd be glad to help you out. So Plan N is a great plan, and it can save you money on your premium versus a Medicare Supplement Plan G, but you do need to be aware that the Part B excess charges are possible, but they're easy to avoid. If you want to make sure you have the best Medicare plan for your needs, call us at the number below or use the link in the description to book an appointment with us. Our services are 100% free, and we'd be happy to help you out. If you enjoyed this video, be sure to click like and subscribe to stay updated on all things Medicare. Thanks for watching the video, and we'll see you on the next one. Thank you.